Dear viewers, we are back and we have been joined by our guest for this evening, Dr. Nasser Alamiri, orthodontist and maxillofacial specialist. Good evening, doctor, and welcome to Hala Kuwait.
Good evening, and thank you for having me here today.
Thank you so much for being here. So in the beginning, I want to know what inspired you to become an orthodontist, and how was your experience, or even how did your journey start at Queen Mary's University?
Sure, yeah. So just to give you a bit of pretext, when we first graduate as dentists, we work in the ministry. And while working in the ministry, we rotate different hospitals and different specialties. So during that rotation, I think while seeing the different ones, I was surprised and happy with the orthodontic field, and that made me passionate about learning more and more about it.
Right.
That's how I went into that.
That's amazing. And you're a lecturer, of course, which I think is pretty great and is not the easiest job on this planet. How do you see the future of orthodontics evolving?
Dramatically. I mean, things have changed within the past 10, 15 years. I think orthodontics at the moment has become more accessible to many people.
Right.
Because it became more convenient, more accessible, and more affordable. So looking down the line, I am seeing that many more people are going to be able to get treatment.
Definitely, definitely. And I think a lot of people are really taking care of their smile now. It's something we know that is very important, no matter how much we take care of ourselves, our hair, our skin, makeup, whatever it is. At the end of the day, if our teeth are not perfect, we will have an issue. So I want to know, what is the biggest misconception that people have about Invisalign or clear aligners? Because that's what I'm counting on one day, if I need it.
Very good question. So just to be clear, clear aligners is a type of braces that's recently has become very popular, and it's a removable type of braces, so it's not fixed. And if we simplify it, there are three main misconceptions with the clear aligners. Number one is that many people think that aligners are only suitable for adults, and this is a misconception, because many children still are very, they're very good patients. They wear aligners, and they have very good results wearing them. The other misconception is that braces or conventional braces are better for treating more complex cases than aligners, and that has changed recently. So as much as, with time things have developed quite dramatically, and every year the aligners evolve more and more and are able to treat much more difficult cases than they did initially. And I think one of the main misconceptions as well is that they all think that all aligners are the same.
Definitely.
It's not the case, however. There are many brands of aligners, and I think each specialist also has his different experience with using these aligners.
That's really great, which means as patients, now we have a lot of options. We don't need to always go back to braces, right? Because I feel like that's everyone's nightmare. Not as children. As children, I think we're excited. Braces and the colors, and we're going to fit in school. But as soon as you're a teenager or my age, that's where braces are a nightmare. So is that where aligners come in, for example, or Invisalign?
Absolutely. I mean, with the innovation that aligners did, I'm getting a bigger segment of adult patients. So in the past, braces was associated for treating children.
Right.
But in the past 10, 15 years, more adults are, using the aligners. Specifically, I mean, for yourself, for example, you wouldn't want to have, fixed braces while giving shows. However, with aligners, you have the ability to wear something and remove it without anyone knowing that you're actually getting treatment.
Definitely, which I think is really great. So what does being an Invisalign provider mean in your field? What does that mean for you?
So what it means is that because Invisalign is a specific type of braces, not all orthodontists are available to provide it. You have to go through certain courses, certain lectures, certain programs. Once you go through that cycle, then you become an Invisalign provider, and hence you can provide it to your patients.
That's amazing. So not any doctor or orthodontic out there can just be using aligners or Invisalign.
No,
definitely. And how has technology like 3D scanning and AI changed orthodontic treatments? Has it done anything different for the doctors or even the patient's experience?
Yes, so much. I mean, I'll give you a very good example. 5, 10 years ago, when we started with Invisalign, we used to take something called an impression. I'm not sure if you've had that done. I don't think so. Have you had
Is it the
braces
thing?
before?
No, I've never had braces.
It's maybe you've done bleaching trays where you,
Right.
you take an
Yes.
impression, right? So in the past, when we take the impression, we have to send it to the United States to get it looked at and treated. And that used to take 3 to 4 weeks. And then sometimes when you send it to them, you know, they give you a message saying that it's incorrect, you have to send it again, which means you have to wait another 4 weeks.
Oh, wow.
In the meantime, all we need to do is take a scan, and you have the result done within 2 to 5 minutes.
That's amazing.
So not only you know, it sped up the time, so the time of treatment is much quicker now, and the patient's experience is much quicker now because you know, he will get the treatment done within a much shorter time.
Exactly, which is really important because I remember my mom obviously used to force me to go to the dentist, as all moms do, I would imagine. And I would remember some things would take weeks, as you mentioned, because we would be waiting for things to come back. So honestly, I feel like this is a push for patients to actually go to their appointments now because they could finish everything in the same appointment, I'm understanding.
Most of the things, I mean, you can see the results with the technology that we have now. You can see the result while you're sitting in the chair. So before you actually start the treatment, you can see how the result will be. And then, you know, will help you decide whether you want to go through with it or not.
Definitely. I think that's really great. And innovation is definitely always there to make things better, I would say, for patients, for doctors, and AI has really changed a lot for us. So I really want to know, at what age should we be looking at braces or taking our children to the clinic to kind of look at them?
So I think that it's important to differentiate between, you know, problems with the teeth and problem with the development of the face and the jaws. So the biggest problems we have sometimes is that the parents bring their children when it's a little bit too late because, you know, they wait until all the teeth come out. Then they think it's time to start treatment. While we always recommend to, you know, bring your child as early as 6 or 7 or 8 years old, because sometimes you can identify problems that are related to the jaw or the face, where if you treat it early, you know, it becomes much easier to deal with rather than wait, you know, in the future. Then things become more complicated, more difficult, and more expensive as well.
Definitely.
So I would recommend as early as 7 or 8.
Oh, wow.
To start your first. I mean, it doesn't mean that you will be getting treatment, but at least you let the child adapt to the environment. You know, he'll get to know his dentist and just to get used to it.
So with some treatments that have nothing to do with teeth, the younger you get them, the faster you heal or the faster you see results. Does that also apply to braces?
Definitely.
So if we get them at a younger age, we won't have them on as long?
Yeah, and you can avoid, I mean, severe things. I'll give you an example. You know, some children have abnormal growth where one of their jaw is too much forward or too far back behind. Now, if you wait until they're in their mid-teens, it's too late to treat. Then the only thing you can do is surgery once they're in their 20s. Whereas if you detect it early, and with the new innovations, there are very simple kind of treatments that you can do to avoid surgery, you know, down the line.
That's really great. Honestly, I think that advice is something parents should be really listening to because the jaw surgery you just mentioned is a very intense one, to be honest, and recovery is not easy. So sometimes just keeping up with the checkups every 6 months, every year, they could really make a massive difference for patients, especially children. Well, of course, we're going to be continuing our interview with you, but dear viewers, we're going to be going to a report on healthy immune system. Stay tuned. Dear viewers, we are back with Dr. Nasser Alamiri, orthodontist and maxillofacial specialist. And doctor, right before the break and the report, we spoke about many different things and of course orthodontic treatments. But for example, I know a lot of people that would find the journey hard or annoying to go through. How do you keep patients motivated during long orthodontic treatments?
I think the key is communication here. So the first thing is you have to explain to the patients exactly what you're going to be doing, set realistic goals, make the time frames very realistic. You know, sometimes I get patients that come and say, I'm going to get married in 3 months. Can I get my teeth fixed? Now, you have to be honest with the patient and say, no, you can't, because these are not realistic goals. On the other hand, some cases take a bit of a long time. So what we do is we always, I mean, going back to the AI, at the moment now we can show them the progress month by month when they come. The patient is able to see how much of the journey he's gone through, how much is left, and what he's expecting, you know, time by time.
Definitely, which I think is really important because, as you mentioned, we're used to that here, though, with our culture, that if we have a big event coming up, we're expecting a full change. And it could be in 3 days, and we're going to ask for a new set of teeth. I don't know how, but I feel very sorry for the doctors, honestly, and the things they go through. So now that you're able to kind of show them with AI, are their expectations a bit more realistic, can you say? Are you able to at least bargain with them or reach with them to a spot where you're able to do your job and they're also happy?
I think maybe with the introduction of AI, it helped us because in the past, they used to, when they ask you a question, you know, you have nothing to show them. It's just based on your experience. Whereas now, for example, if I'm using Invisalign, they know from day one how many weeks they're going to be in treatment.
Yes.
So it's not a surprise to them if it's going to be 6 months or 9 months. They know that before they start. So that helps the process as well.
Perfect, of course, and it makes everyone's life a bit easier.
Much better.
Definitely. Yeah. When it comes to trust between a patient and a doctor, I personally think it's so important because that's where I would know that I'm in safe hands and I can trust the whole process and the journey when it comes to the treatment. So how important is social media when it comes to building trust between doctors and patients?
Oh, it's a tough question. I mean, I think social media has its advantages and disadvantages, to be honest. If I'm going to talk in terms of the patients, it's a great advantage for the patients because at the moment, you know, they can see their doctor before visiting him. They can select a doctor. They can see how he talks, how he reacts, how he looks like. They can see the cases he's done, which gives them a sense of comfort. You know, once they're in the clinic with the doctor, they're not in a, let's say, you know, a different environment. They feel that, you know, they've been here before. On the other hand, I think that in the past, you know, you would go to a doctor based on the word of mouth or based on his experience or his good cases that he's done. Whereas now it's a little bit social media driven, which brings maybe some injustice for the doctors that don't have a social media platform. I mean, I know a lot of colleagues that are great, you know, dentists, but they just don't like, you know, posting things on Instagram. And I think it's unfair for the patients to not have access to these doctors. So I think it's, you know, it's one of those situations where there's an advantage and a disadvantage.
Definitely. I believe the best method to find the right doctor is looking at their credentials, where they've studied, years of experience, whatever it is, honestly, plus social media if they have it, and of course word of mouth, because as you mentioned, we're missing out on amazing doctors because they're not on social media. And I don't believe it's their job to, you know, be an influencer.
And we're pressured a lot now to have a social media account.
Exactly.
And the problem with that, if you look at it, is because being a dentist, you're limited to the things you can talk about. And, you know, if you want to be like a social media influencer, there's, you know, you have to be involved every day.
Exactly.
It's not easy.
Honestly, it's another full-time job.
It is.
You doctors are doing more than
I'm sure you
enough.
know more about that than me.
Definitely. So what do you think is the difference that you have noticed between Orthodontix in Kuwait and abroad?
I think that in Kuwait, it is much more accessible. I think that much more people are allowed to get orthodontic treatment in Kuwait because we have so many great dentists in Kuwait. In both the private and the government sector, the waiting times is much less than abroad, and the options available are, you know, almost infinity. There's so many good places to go.
Definitely.
So it's much easier to have access to treatment here in Kuwait.
Which is really great because I've heard from people in different countries overseas that to get to an orthodontic is a very long process.
It is.
Right? So how does it work here in Kuwait? Do you just go see a specialist, do you get referred, or do you go straight into your appointment?
So there's two lines or two segments, let's say. If you're going to be doing it in the government sector, you have to get a referral from your normal dentist, which is, you know, in the polyclinics. Whereas, and you know, you get seen within 1 or 2 weeks, I would think. And in the private sector, you get an appointment within the next day if you'd like. It's much easier.
So as soon as you're ready.
As soon as you're ready.
To see your doctor. That's really great. So I know there's a lot of dentists or students right now studying. So what advice would you give young dentists about specializing in orthodontics?
I think it's a very competitive field at the moment. I think one of the most difficulties they will be facing is getting accepted to that postgraduate you know, course. So to be able to be accepted, I think that they have to work very hard at the moment in empowering their CV. They have to get a lot of experience shadowing. You know, they have to visit actual dentists and work with them, practice. Yeah, these things. Yeah.
Definitely. So honestly, I feel that way about marketing, for example. Whenever I meet someone new, they're always in marketing. So is Orthodontix becoming the marketing of dentistry? There's a lot of people in it. Would you say that it's better that they look at another segment of dentistry?
Oh, that's a very good question, actually. Maybe they won't like me if I say that, but yeah, I agree, because not only there's a lot of orthodontists, but I think that the dentists are going to be able to do a lot of work that was only specified to orthodontists. So it's going to be a difficult specialty to break into, especially you're looking at, you know, after graduating, you need another 3 to 4 or 5 years of specialty. So it's not an easy entry.
Definitely. There's a lot that goes into it.
There's a lot of effort.
Definitely. And I think with all the innovation out there and our access to social media, we're seeing different treatments of orthodontics around the world. We're expecting everything in the same place too. So I feel like an orthodontist has to be studying the whole time, like it never ends.
It never ends. And especially with the technology, because there's something new every year by year. I mean, you know, when I graduated, Invisalign wasn't out there. Clear aligners wasn't as much as, it wasn't as popular as it is now. I had to learn it while I was working, not while I was studying. And I'm sure, you know, the years coming, some new technology will be available and which we will have to continue learning about.
For sure. So I want to just go back to braces and Invisalign one more time before we end this evening. What is the difference when it comes to treatment time? So if the braces are going to take me a year, will that be doubled with Invisalign, or am I still able to get the same kind of duration when it comes to my journey as a patient?
It's a case-by-case selection. So in general, I would say Invisalign might be slightly quicker. So
quicker?
Yes. So for example, if you would take 9 a case with Invisalign, you can finish it in 6 months. So you know, you save 2 to 3 months. But it is a bit case selective. So for certain cases, I would still think that fixed appliances or normal braces is more superior than Invisalign.
Right.
But for the other cases, Invisalign is magic almost.
Amazing. So usually if we're worried about the aesthetics of it, we do lose a lot when it comes to treatment. It's kind of the pro and con of the situation. So I'm actually very surprised that with Invisalign, we're able to get the results quicker than the traditional method.
And even for some cases, you get better results than with normal fixed braces.
Interesting.
I mean, every year Invisalign advances their trays. You know, they develop new technology, they develop new methods, more sophisticated protocols, and so every year we're getting, you know, more improvement with Invisalign year by year.
Right.
So I think that, I mean, moving forward, probably within the next 5 to 10 years, I don't think there will be any fixed braces. I think it's only going to be Invisalign and removable trays.
I think that's very good news to everyone, because that would mean even that kind of treatment would become even more affordable.
Exactly, and more accessible as well.
Definitely more accessible to everyone, and we won't be bullied anymore about, you know, the traditional metal braces. So I mean, think that's really good news.
15, 20 years ago, we used to treat cases using something called the headgear. And the headgear is a big thing that you wear on the top of your head and sticks out of your mouth.
Right.
Now,
Things
that
have
doesn't
changed.
exist anymore, so yeah.
Definitely. Well, Doctor, thank you so much for all the advice that you have given us this evening, and for helping us understand the difference between braces and Invisalign. Thank you for being here.
Thank you for having me. I hope that I've answered most of the questions.
Thank you. Dear viewers, we had with us Dr. Nasser Alamiri, orthodontist and maxillofacial specialist. Stay tuned for our report.